So now we need to practice getting up from a chair after surgery. So you're going to need to kick your affected surgical limb forward, because again, you're not going to be able to bend it very much. And now you want to bring your nose over your toes so you can get some weight shift onto your legs. And you'll push with both arms first. You want your arms pushing from the thing you're sitting on. Then, once you're stable, grab the walker with one hand, then grab the walker with the other hand. And now you're good to go. So again, one more time. You're going to lean forward, kick that leg out, push with both arms, reach with one arm for the walker and the other. Perfect. With your walker, you need a 30-degree bend in your elbow. That's how high the walker's supposed to be, so adjust it accordingly. And make sure your house is super safe, that you're not slipping on things. We always want to walk with good footwear, nice and safely. So, when we're walking, we have to get you back at it. So, you're going to be walking like this, one foot in front of the other, trying to get back to walking normally. And the walker slides. We're not picking it up or anything. Slide, step, slide, step. Because over time, you might not need it anymore. Perfect.